Laila Joy, please lead the prayer.
Are you ready to pray?
Yes.
In the name of the Father, the Son, and the Holy Spirit. Amen. Our Father, who art in heaven, hallowed be thy name, thy kingdom come, thy will be done on earth as it is in heaven. Give us this day our daily bread, and forgive us our trespasses, as we forgive those who trespass against us. Lead us not into temptation, but deliver us from evil. Amen. Father, the Son, and the Holy Spirit. Amen.
Good morning, class.
Good morning, ma'am.
Let us check your attendance. Once I call your name, please raise your hand. Mary Joyce Parang.
Present.
Great Joy Tapel.
Present.
Sandy Margurio.
Present.
Princess Gina Tapel.
Present.
Shansis Mundo.
Present.
So, before we start, we will have an activity. This is what we call Penoy Henyo. This is a guessing activity. The students will be divided into 3 groups, and each member of the group should have pair. The pairs have their own task. Player 1 will be the one to tell player 2 if the word being guessed is correct. With oo, hindi, pwede only. Each group will be given 5 words to guess. They have to finish it in 1 minute. The first group to finish guessing all the words will be the winner. So, let's start.
Ako hindi ko magaling.
Ay, ako, hindi.
Hindi, ako, hindi. Ikaw yung mga nila.
Start.
Communicable disease.
Hindi.
Ano? Ebola.
Hindi.
NCOV.
Hindi.
Rabies.
Hindi.
Measles.
Hindi.
STD.
Hindi.
Ano yun? HIV.
Hindi.
EPA.
Hindi.
Ano yun? Influenza.
Hindi.
Chickenpox. HIV.
Hindi.
Measles.
Hindi.
Ebola.
Hindi.
Influenza.
Hindi.
Rabies.
Hindi.
Measles.
Hindi.
NCOV.
Hindi.
Zika.
Hindi.
Influenza.
Hindi.
STD.
Anong time na?
Pwede ko yung dalawa.
9 seconds. Tigpos ko.
Let's start.
Ebola.
Hindi.
Zika.
Hindi.
Influenza.
Hindi.
Chickenpox. Rabies.
Hindi.
Measles.
Hindi.
HIV.
Hindi.
STD. Zika.
Hindi.
Chickenpox.
40 seconds.
Influenza.
Hindi.
Ebola.
30 seconds.
HEPA.
Hindi.
HIV.
Hindi.
Measles.
Hindi.
NCOV.
20 seconds.
Ano ba? Ano yun? HIV.
Hindi.
HEPA.
Hindi.
Measles.
Hindi.
NCOV.
Hindi.
Chickenpox.
Hindi.
STD.
Hindi.
Zika.
Time. Time's up.
1, 2, 3, go. Time starts now.
Hindi. HIV. Hindi. Tuberculosis. Hindi. Rabies. Hindi. Influenza. Oo. Tuberculosis. Hindi. Mumps. Hindi. HIV AIDS. Oo. SARS. Tuberculosis. Hindi. Oo.
Time. 20 seconds.
Rabies. Hindi. Tuberculosis. Hindi. SARS. Oo. Good. Influenza.
Ivy?
April.
Babies?
Oo.
Okay, starts now.
COVID-19, meningitis, hepatitis A, mumps,
50 seconds.
COVID-19, rabies, hepatitis B,
40 seconds.
mumps, meningitis, rabies,
30 seconds.
COVID-19,
Class, what did you notice on the following diseases you've guessed? Any? Sheena?
It's all about communicable diseases.
Very good. Those concepts you have guessed are related in the topic that we are discussing right now. But before that, let's unlock first the difficulties you will encounter in our discussion through an activity. Let us have batching time. In column A, you can find the words which are difficult to understand and their meanings in column A. Who can match the first word? Sheena. The second word, Mary Joyce. Next word, Sean. Number 4, next word, Sandy. Last word. Last word. Great.
Ma'am, pwede kami palitan. Malipat.
Hindi ko ipakataas mo ito.
Are you sure in your
No.
answer? No.
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 Change it. Now you have already understand all those terms related in our discussion, so let's proceed. do you know about communicable diseases? Mari?
Communicable diseases are illness that is transmissible that can cause infection to a person.
Yes, very good. What else?
It is contagious and infectious.
So, communicable diseases spread from one person to another or from animal to a person. The spread often happens via airborne viruses or bacteria, but also through blood or other body fluid. The terms infectious and contagious are also used to describe communicable disease. In what way did this communicable disease spread from one person to another? And Sandy,
Through airborne viruses.
who can give me example of communicable disease? Sheena.
Dengue fever.
Marie Joyce. Sandy.
Meningitis.
Great.
STI.
Acute respiratory infection.
Very good. So, those are common communicable diseases. What do you know about acute respiratory infections and flu? And Mari.
It is a contagious illness that is caused by influenza virus.
Very good. So, influenza, known as flu, is a contagious respiratory illness caused by influenza viruses. It can cause mild to severe illness and at times can lead to death. The most effective way to prevent flu is by preventing the spread of germs. So, what are the possible causes of this disease? Sheena?
It can cause mild to severe illness and at times can
And how can we prevent? What is the most effective way of preventing it? Mari?
By preventing the spread of germs.
Very good. So this is the precautionary measures in order to avoid these diseases. So number 1, get vaccinated. Getting vaccinated is the best way to be protected from flu. Every individual from 6 months of age and older is advised to get the seasonal flu vaccine, which is available by shot or nasal spray. This is especially recommended if one lives with or in close contact with someone at high risk of complication from flu. So number 2, take everyday precautions. Observe personal good hygiene habits and follow the everyday steps to practice in life to protect oneself from flu. So number 3, undergo preventive antiviral medication. Even you are healthy but exposed to a person with the flu, you still have to be protected by means of antiviral drugs. Antiviral drugs are prescription pills, liquids, or inhalers used to prevent or treat flu viruses. The sooner you are treated with an antiviral, the more likely it will prevent the flu. Consult your doctor for proper antiviral medication. So, to recap, how can we prevent or what are the precautionary measures in order to avoid this disease? Shan,
Get vaccinated.
very good. What else?
Take everyday precautions.
And last,
Undergo preventive antiviral medication.
very good. What is the next diseases? Mari?
Bronchitis and pneumonia.
So what does bronchitis and pneumonia all about? Pneumonia and bronchitis can be prevented by practicing good hygiene and stopping the spread of germs. Among the preventive ways are the following. When you cough or sneeze, cover your mouth and nose with tissue or hanky to catch the germ. Then throw the used tissue away in a bin or toilet. Number 2, wash hands regularly to avoid transmitting germs to others or objects by contact. Number 3, have yourself vaccinated to be protected against pneumococcal infections. Number 4, quit smoking. Smoking damages the lungs, which makes you easily infected. So, what are the preventive ways to avoid this disease? Sheena,
Cover your mouth and nose with tissue.
very good. Very good. Now, what is tuberculosis? Ma'am, Sheena.
Tuberculosis, also known as TB, is a disease caused by bacterial microorganism, the Bacillus mycobacterium tuberculosis, through the air from one person to another. Commonly, it attacks the lungs, but also other parts of the body. Tuberculosis spreads by droplet infection. TB patients exhale, coughs, or sneezes tiny droplets of fluid containing tubercle bacilli, which are released into the air and can be taken into the nasal passages and lungs of a susceptible person nearby. Anyone who comes into contact with an individual infected with tuberculosis is at risk of developing the disease. It is estimated that 1/3 of the world's population is infected.
So what is the one example of tuberculosis? Shan.
Mycobacterium tuberculosis.
Very good. How does TB spread from another person? Sandy.
Spreads by droplet infection.
Very good. So how can you prevent TB and what are the preventive ways to avoid this? Mari.
The following should be observed by the person infected with tuberculosis to help prevent the spread. Always cover the mouth when coughing. Take all medications as required. Get shot with tuberculosis vaccine, BCG, or Bacillus helmet glory.
Very good. So in order to prevent this tuberculosis, we need to follow this. So, who among you has an idea on what malaria is? Malaria. So malaria is a preventable parasitic disease transmitted by Anopheles mosquitoes. This is prevalent especially in Sub-Saharan Africa and Southeast Asia. So this malaria is a disease transmitted by Anopheles mosquitoes. And what's dengue fever? Great.
It is a great bone fever.
Who can read? Sandy.
Dengue fever, also known as breakbone fever, is an infectious tropical disease caused by the dengue virus, which is transmitted through the bite of an infected female aegypti mosquito. Symptoms may include fever, headache, joint pains, and skin rashes. They may develop into life-threatening dengue hemorrhagic fever, resulting to low blood platelet counts, bleeding, or into dengue shock syndrome, resulting from dangerously low blood pressure. Anyone can be infected with dengue regardless of age, sex, race, and socioeconomic status.
So how could the disease transmitted? Shan.
Should the bite of an infected female or aegypti mosquito.
Very good. And what are the symptoms in dengue? Mari.
Fever, headache, joint pains, and skin rashes.
Very good. So it is evident that the dengue fever is a very serious disease that can cause to death. So who can give me an example or explain it to prove the statement?
Ma'am.
Sheena.
When you have a dengue fever, it may become serious and turn into dengue hemorrhagic fever, which may result to low blood platelet counts, bleeding, or into dengue shock syndrome resulting from dangerously low blood pressure. It may also cause organ damage and dehydration.
So excellent. Now, knowing the dengue fever is a serious disease, how could you prevent it? Mari?
Use insecticide, wear long sleeve shirts and long pants, and control the mosquitoes inside and outside your house. And also, sleeping under the mosquito net can also prevent mosquito bites.
Very good. Yes. Okay. So, who can read? Sandy.
The primary prevention against dengue is by reducing the habitat and the number of mosquitoes, and to limit exposure to mosquitoes bites. Control of breeding habitats may be done through the following. Eliminate standing water near canals. Change water in the flower vases regularly weekly to discard eggs. Cover drums used to collect and hold rainwater. Use door and window screen to reduce indoor mosquitoes. Use mosquito repellent on skin and clothing for protection against mosquito bites. Wear long pants and long sleeve for additional protection from mosquitoes.
So next, what is STI? Sheena.
STI is sexually transmitted infection.
So, what does STI is all about? Anyone? Great. Great. Great.
Sexually active with multiple partners expose themselves to higher risk of infection.
Anyone? Who else? So STI is those who are sexually active with multiple partners expose themselves to a higher risk of contracting infection. These diseases are preventable and curable. So, who can give me an example of infectious disease that are sexually transmitted? Mari.
Hepatitis B, UV lice, bacterial vaginosis, HIV or AIDS, then gonorrhea.
Very good. Who among you are familiar with HIV or AIDS? All. Okay. So who can give their ideas about HIV? Sheena.
HIV is a human immunodeficiency virus that is caused by having a sexual intercourse with multiple persons.
Very good. So let's talk about the following are the types of STI and STDs. So number one is bacterial. So under bacterial is chlamydia. Appears 1 to 2 weeks after contact with an infected person. Its symptoms resemble those of gonorrhea, and if untreated can cause pelvic inflammatory disease among women and sterility in both men and women. So chlamydia appears in 1 to 2 weeks after the contact with another person. Yep. So number 2 is viral. Genital herpes or herpes simple type 2 is a viral infection that appears usually a week after sexual contact with an infected person. This can easily be transmitted from open blisters and can cause itching and pain in the genital area, painful urination, and general fatigue. So number 3 is genital herpes. It can appear usually at 2 weeks after sexual contact. So AIDS. HIV or AIDS stands for Human Immunodeficiency Virus (HIV) and Acquired Immune Deficiency Syndrome (AIDS). HIV harms the immune system by destroying the white blood cells that fight infection. AIDS is the final and worst stage of HIV. So, AIDS daw is the final and worst stage of HIV. So next is genital warts. Or venereal warts are contagious, projecting tissue or clot on the extreme genitals or anus. This is caused by direct sexual contact with a person with HIV. So number 3 is under parasiticus. Trichomoniasis is caused by the parasite Trichomonas vaginalis. Symptoms includes the itching in the genital area, bad smelling, thin vaginal discharge, burning sensation when urinating, and pain during intercourse. So this is the symptoms included in the trichomoniasis. So HIV/AIDS is a retrovirus that causes HIV infection. The successful entry of HIV in the human host weakens the immune system. So AIDS, on the other hand, AIDS is caused by HIV contracted from another person. This attacks and weakens the body immune system, making the afflicted individual susceptible to other life-threatening infections. So who can read?
HIV or AIDS victims being found to have lymphocytes or white blood cells. Thus, they are at a high risk for many numbers of infectious diseases. The virus is transmitted with blood-infected body fluids or sexual contact with an infected person. The certain way to protect oneself from HIV is to obtain from sexual intercourse, especially with an infected person. The following should also be considered for protecting. Never share needles. Be sure to disinfect needles when using. Do not share personal items that may have blood on them. This includes toothbrushes, razors, needles for piercing, and blades for cutting.
So knowing all the symptoms and effects of HIV and AIDS, what way can you prevent it, or how could you prevent it?
Use condom.
What else?
Take medications that can prevent HIV.
Very good.
Avoid having a sexual intercourse with multiple persons.
Excellent. Why do you think prevention is the best? Mari.
Prevention is the best to protect oneself and others.
Yes. Very good. Who can read?
Ma'am,
Sheena.
prevention is the best. To protect oneself and others from HIV, education, prevention, and communication are the key factors. Although medical advances have progressed since the discovery of HIV/AIDS virus, it is still a serious health threat and should be prevented at all costs. Abstinence or abstain from sexual intercourse. Be faithful or have a monogamous relationship. Do not share needles, sterilize needles. Educate and inform people.
Very good. This communicable disease should be prevented. But the question is, how could we prevent it?
Educate people.
Do not share needles.
Be
Who else?
faithful.
Very good. So, let's have an activity. You will perform role play that show preventive ways to avoid these diseases. So, you will base on this criteria. And after that, you will perform and explain your work. So the criteria is representation 50%, creativity 25%, and a group participation is 20%. So I will give you 5 minutes to rehearse and perform it in person.
Ikaw na lang mag-reporter. Ano pong masasabi nyo sa...
Ma'am, pwede tabi yung Tagalog.
Oo. Ano pong masasabi nyo sa mga kababayan about sa HIV? Ay, ba sa audience?
Oh, so ngayon po, no?
Tapos ikaw, sana
Kasi ngayon tayo nasa...
cameraman ko, mali ka namin niya. Ay, pero kung kaya.
Ayun yung mas... Ayun yung mas...
Ikaw yung advocate, ako yung reporter. I-interview ka.
Ang hapot mo lang sa kusal ko, mas
Miss, what is this all about? Your symposium. Please explain.
bako maral kay Audrey.
Sabi mo, saro lang.
Pero kasi na yun, gabos na yun, natin na yun. So,
Okay, class, time's out. You will perform now.
Okay, ma'am.
So, good
So,
afternoon.
ayun po, dito po tayo sa isang symposium.
Salamat po sa pagpunta ninyo sa symposium about HIV. This will be help to spread awareness about HIV.
Ngayon, interview po natin ang kanilang guest speaker. Hi, Miss Princess. Hi po. Para saan po itong symposium na ito?
It's all about HIV awareness na pinandak po ng aming team for specific barangay po dito sa San Miguel to spread awareness about HIV among people, especially those teenagers na vulnerable sa ganito.
Okay. At ngayon naman ay mag-interview tayo ng isa sa mga umattend ng symposium. Ma'am, ano po yung mga natutunan nyo ngayong araw?
HIV can kill cells or can destroy cells in our body and can cause, it has different effects like shortness of breath and worse, it can lead to AIDS.
Ito naman po si Miss Chan.
Gusto natin debate for
So, ayun po, yun po yung mga tao dito sa symposium at maibalik ko na po sa inyo sa studio.
So, your work is excellent and good job. So now, class, what have you learned in our discussion today? Okay. Sheena?
the communicable diseases and preventive ways on how to avoid it.
Very good. Is there any questions?
None.
None.
So, I will distribute a sheet of paper and we will have a short quiz. Hello? So, our quiz is match the diseases presented in column A with the description information presented in column B. Write the letter of your answer. Happy matapos!
Pass the paper.
Done?
Yeah.
Yes.
Let's check. So, number 1. Who can read? Sheena.
Transmitted through the bite of an infected female Aedes mosquito. Letter A. Dengue.
Correct. Number 2.
It is a parasitic disease transmitted by Anopheles mosquito. B. Malaria.
Correct. 3. Mary Joyce.
It is a disease caused by airborne bacteria that commonly attacks the lungs. Tuberculosis.
F. Correct. 4.
It is contagious viral respiratory illness. Letter C. ID. Malaria.
Correct.
C.
Ay,
C.
number 4 na.
Number
Ang
C.
polvo ng
No,
C.
C.
ID ba? ID.
It is caused by piracy bacteria transmitted by direct sexual contact. Letter E.
Yes. Correct. Who get 5 points?
4 points, ma'am.
Okay. So, class, this is your assignment. Answer stand up for the challenge on page 79 here. So, now class, do you have any question? Class?
None.
Class dismiss.